Italy is at war. Coronavirus has hit the country harder than China. The outbreak has imposed a total lockdown. Life is on hold as the shadow of disease and death hangs over the country. Don't go out to avoid being infected, to avoid the breakdown of hospitals and, above all, of intensive care units.
There won't be red zones anymore, there won't be a Zone 1 and a Zone 2 anymore. There will be Italy, a protected zone.
Making the entire country a so-called zona rossa is considered the only measure that can halt Covid-19 coronavirus.
Italy has the most cases in Europe and the largest number of infections outside of Asia.
The mood here is not great. As you can see, streets are emptier and emptier.
Many outside Italy think that the pandemic only affects the elderly. 41-year-old Gianni ZAMPINO took to social media to tell them they're wrong.
I didn't do anything to avoid getting this virus, which unfortunately got inside my body and killed the person I loved most in my life, my father. Everybody says that this virus is a normal flu. I can tell you it's not a normal flu. It gets inside you, and it takes hold of you, and it takes your lungs.
The number of cases worldwide is over 245,000. These red dots on the map are mainly grandfathers, grandmothers, moms and dads. Italy is the most affected country worldwide, with over 40,000 cases. More than 3,000 have died, and the infection is still spreading.
Unfortunately, the disease numbers are not reducing, they are still high. Soon we won't be able to give an answer to the people getting sick anymore.
The region of Lombardy has the highest number of cases. In the recent days, it has registered almost 1,500 new cases per day and around 300 deaths. The peak is expected in the next few weeks. Euronews spoke to one doctor on the front line who has been fighting against coronavirus since the very beginning. She asked to remain anonymous. Our intensive care units are overflowing. We don't know where to host patients anymore, but we go on creating new places in any possible area in our hospital. We have closed routine operating theaters. Only 2 are working for emergencies, and the other ones have been used as intensive care rooms. Bergamo has the highest number of victims, its obituary section in the local newspaper stretching to 10 pages.
9 e 10. Una semplice influenza.
Coffins are overflowing local facilities. There is a waiting list for funeral services despite the crematorium working 24 hours a day. The army has ended up taking coffins to Modena and Bologna.
We're working around the clock. We've even had to ask support from funeral parlours in other regions, and they've arrived from Emilia-Romagna, from Trento, to help us out.
While Lombardy is overwhelmed, cases are rising in the nearby regions of Piedmont and Veneto. Turin and Venice are waiting for the peak.
In Piedmont,
we still don't know, and we'll find out this week if cases will rise exponentially like in Lombardy. This means we might find ourselves in the same situation just 10 days afterwards, or we might have a linear rise like now, where we have 15 to 20 new patients needing breathing assistance every day.
It's like a trench war for doctors. Hundreds have been infected and increasing numbers are dying. Some are working with no gloves as stocks are limited.
I've seen heroic acts from some of my colleagues and listened to doctors who refuse to have the test done in order to avoid being recognized as positive and then isolated, as they want to continue working with positive patients rather than being quarantined.
The most distressing thing is to see people who are dying in complete solitude. Because we cannot let anyone in to see them anymore, and so we are the last people they see in their lives.
It's not a game. I spend my nights on a respirator and I can't sleep. My life has been turned upside down, and I wish no one to feel the suffering I've gone through. Because this may look like a horror movie, but it's not.
Italy is the first country in Europe to wage the war against coronavirus. Its institutions, its healthcare workers, and it's the entire population uniting with one motto in mind: we will make it.
How do you feel seeing the country as it is?
I was only 2 years old when the Second World War was over, and in my lifetime I've never seen anything like this. But the provision of alternatives has been good everywhere. Smart work, distance teaching, etc. are really displaying a degree of mobilization of an immobile society which is remarkable.
The government has extended the lockdown until the 3rd of April, and Italians adjust. After a sense of distress, the urge for getting organized has prevailed. I said to myself, let's take it as an opportunity to stay with the kids and look after them better. Even in these circumstances, Italians have found the way to raise their voices and send a message of hope and resilience to the rest of the world.
Ecco, ci siamo anche noi! Ce la faremo!
Ce la faremo!